Yeah, I do have a channel like Oncophysio.
Mm-hmm.
So my main aim to start the channel is to get broad classifications of how the oncology patients can be handled, because it is not that we can handle a normal patient the same category we can put an oncology patient in it. So oncology is itself a systemic disease. So we should have an overall view of the system. Yeah, actually, the main aim of my channel is to reach out the physical therapist,
Mm-hmm.
to teach them and to give them a knowledge about how to handle and medical patients. It's not like something we can do for an oncology patients. We can't jump and we can design a treatment for them. We have to look in a broad spectrum. So it's mainly for the therapist. Some of the doctors have started referring the patients like prior surgery, how to train their lung, so
Mm-hmm.
that we can maintain the lung volumes and wean off the ventilator easily.
Okay.
And if the patient is going for an RT, uh, we can tell them how the hand position should be, so that they can easily accommodate. As days passes during the RT, usually due to this fibrosis, those things and all, the hand position will change. So
Right.
if we prehabilitate them, then they can achieve a more efficiently. Yeah. Sure. Nowadays, the patients are in good shape. So they
Okay.
have a broad spectrum of mind, so that they are willing to come for rehabilitation.
Well, that's
So
very
they are
nice.
ready to, yeah, they are ready to take what the forthcoming will be. So once we teach them in the right way, they are ready. And almost like if you take some 10 patients, like
Mm-hmm.
around 8 patients are ready and they are achieving it.
That's a very nice
So it's all,
shift. That's a very nice shift.
yeah, it's all about how we teach them.
Options.
But I think that's
One of the major problems facing in healthcare system in countries with poor socioeconomic status and developing countries such as India is the need to strengthen the system through the rapidly evolving information about precision cancer treatment creates a knowledge gap in the education of oncology between the healthcare system and in the healthcare professionals regarding complex and important concepts along with the approaches of for identifying the therapeutic strategies and individual for the individual patients. So informing the students or the fellow community to outreach the rehabilitation program, several have been developed to evaluate the preferences according to the learning style models. Like if you take in South India itself, combined of 4 states, we have only 4 to 5 people who are certified enough to handle a patient who is having a breast cancer related lymphedema. So it is not that uh, only educating. So it's not that only through the help of hospitals, increasing the hospitals alone will handle the problem. It is the therapist that they have to be done. Because once we increase the number of therapists by educating the fellow students who are about to come out of the college, where they are going to practice physiotherapy, so they will be easily taken these kind of new treatment protocols, right? So it is not like that only we have orthopedic rehabilitation, neuro rehabilitation, cardio rehabilitation, pediatric, geriatric, those kind of stuff. We all know those kind of stuff, right? But we are in a state where we have to develop a protocols, develop a rehabilitation panel for breast cancer survivors.